This segment is brought to you by Busamed Parterflay Private Hospital.
Dr. Olivier, thank you for joining us on Living Your Best Life.
Thank you very much for inviting me.
So we're going to talk about hip replacements, and I think we all have an understanding of what a hip replacement is. But what are some of the conditions that lead to one having a hip replacement?
There's various reasons why people will get a hip replacement. The most common reason, obviously, is as we get older and we get a degenerative hip. That's the most and the bulk of the patients we see that will eventually end up with a hip replacement. The others that will come to us are patients who either had a trauma, like they were involved in a motor vehicle accident, for instance, at a younger age, or at an older age, obviously. The other reasons is some patients are known with rheumatoid arthritis, for instance, and that sometimes also destroys the hip or the knee joint, and they have to be operated. And then you get other reasons, which is more scarce, like avascular necrosis of the femoral head, where there's a problem with the blood supply, and then that head collapse. So there's various reasons for this, depending on which age you present at.
Hi, I'm Kobus Kutsia. I'm from Somerset West. I'm 38 years old, married for my sins, with 3 kids. My lifestyle was quite active. I trained and competed in 3 Ironman events in 2018. I took a month of training in July, and I started noticing pain. It was around about the 22nd of September of 2018. We were on holiday in Elkeralsmond, and my laity and I went for a morning run. I actually laughed at him because he fell with his bike, and I guess karma came back to bite me. 10 k's into the run, I felt quite a pain in my left shin. The first thing I noticed after the pain and after showering was have more beer, but it didn't help, and I came back, and my physio was a lady by the name of Karen Adam. She thought I had a labrum tear, which is quite a lot simpler than the issues it ended up being. And I was then referred to Dr. Olivier, who sent me for an MRI scan, which was done December of 2018, literally the day before I went on holiday. What he told me was quite a shocker. Apparently, I had developed a condition called avascular necrosis, which is bilateral and it affects both hips. He gave me the news that I need new hips. Was quite unexpected, and it was a shock, and we started making plans to have the procedure done.
Okay, so let's talk about the procedure itself. Let's take it back a little bit and let's look at the advancements.
So when we started doing hip replacements about 40 years ago, it was a very simple operation with a simple stem. I'll use this as an example. So we had a stem that was put in with a metal head inside a cup. Over the years, things have evolved. We've changed now from some prosthesis that gets fixed with a stem without cement, and others that get fixed with cement. We've got different options to fix the cup, with or without cement. So that means how you initially bond it to the body. And then over the last 10, 15 years, the most important thing was the bearing surface, which basically means how this head and the cup inside the sockets articulates. So we've got options available. We've got a metal that can go onto plastic. We can do metal on metal in certain cases. Some of them you can use ceramic on a ceramic. Some of them you can use ceramic on a plastic. So there's different materials we can use. And then you get also what changed over the last couple of years is the different approaches. Some surgeons use a posterior approach, some use an anterolateral approach, and then the buzzword at the moment, the anterior approach. And that basically is all about how you get into the hip joint. All of them have their pros and cons, and it depends on how comfortable the surgeon is with whichever approach he wants to use. In some patients we will say, but for this patient a posterior approach will be better. In some patients maybe a direct anterior approach will be better. But if we look at the literature out there, they all do exactly the same after a certain amount of time. So it might make a difference in the first 6 weeks, but after that, if your surgeon does a posterior, anterior or anterolateral approach, your results will most probably end up being the same.
There's very little scarring. It looks like a small little cut. I think Dr. Olivier is quite good at needlework. He did a very good job in sewing me back up, and in a few months' time there'll virtually be no scarring at all. My quality of life has not been affected. The only concern I had was the discussion around running again going forward, and my wife wasn't too happy with it. My GP wasn't too happy with it, but Dr. Olivier said he'll rather have me running, and he agrees. He said I can do what I want. I can do Ironman again. He doesn't want to know, but he wants pictures. So it's quite fun. I've got a few amazing photos to brag with. I get a lot of special attention at the airport. People all of a sudden like to touch me because I set off the alarm. It's quite fun.
So once the hip replacement is done, what should the patient be aware of?
Initially, obviously, there's the risk factors shortly after surgery, which is the main ones is the dislocation that I mentioned. They can initially have a bit of medical issues that we have to sort, but we look at all those issues preoperatively. For patients that's a bit older, we get our team involved to look at their house setup. Are they living on the second floor with stairs? So we have to accommodate them to get up to their bedrooms, for instance, get down to the toilet if it's downstairs. All those things we have to look for to see that they are mobile, they can look after themselves. They're definitely allowed to do stairs without a problem. And then we just get them stronger. Usually, patients who come at the 6-week visit, they will tell you, I've never had pain after my surgery because the anesthetics has improved over the years. So except for the restrictions in the first 6 to 12 weeks, after that, you carry on with your life.
Perfect. Well, thank you for joining us on Living Your Best Life.
Thank you very much.
Busamed Paardenvlei Private Hospital offers more than exceptional clinical care by bringing our company values of accountability, friendliness, respect, integrity, and quality care to life. Busamed Paardenvlei Private Hospital offers their patients and their visitors the ultimate Busamed experience. Premium care, personal touch.